I wanted to spend a few minutes speaking with you about our mental health care system and how some much-needed reforms have now passed the House with a bill I co-sponsored. Empowering patients and caregivers, ensuring availability of treatment, and encouraging students to choose careers in mental health, as well as providing for those on the front lines and maintaining transparency in government programs, are all critical aspects of mental health reform. That's why I voted for H.R. 2646, the Helping Families in Mental Health Crisis Act. This bipartisan legislation addresses critical components of mental health treatment. Families can partner with mental health professionals and other medical professionals in delivering health care. The number of crisis mental health beds is proposed to be increased, so those in need of inpatient, immediate care for the short term have access to care for stabilization. The legislation also boosts the availability of treatment to those in rural or underserved areas through telepsychiatry. Doctors can be linked to psychiatrists and psychologists in these areas. It is critical we encourage students to choose careers in mental health, and that's a centerpiece of the Helping Families in Mental Health Crisis Act. The legislation works to expand the mental health workforce by establishing a grant program for psychology students at many levels to participate in community mental health settings, and for the first time through the Minority Fellowship Program. It also directs the federal government to implement a strategy for increasing the amount of people who practice psychiatry and psychology for all ages, as well as clinical social workers and mental health peer support specialists. In addition to promoting a mental health workforce, this bipartisan legislation also creates a grant for specialized training for law enforcement and first responders, so they can better recognize individuals with mental illness and know how to treat them. The legislation brings accountability to federal grant programs by creating the National Mental Health Policy Laboratory, which would establish benchmarks for mental health grants and focus on innovative treatment. Lastly, the bill directs the federal government to coordinate its mental health research, treatment, and housing programs for those with mental illness. So we are focusing on the programs with best results and not wasting resources. Providing for mental health treatment and programs, seeking innovative solutions and best practices, and also ensuring we continue to raise awareness are all critical to a well-functioning mental health care system. I will continue to work on this very important issue in Congress. Thank you.